Grabbing a sugary drink out of a vending machine is pretty normal for most people. The State Department of Health says that kids ages 1 to 5 are opening up a can a little too often.
Everyone 2 years of age and older should keep their intake of added sugars to less than 10% of their total daily calories. Children younger than 2 years of age should not be fed foods and beverages with added sugars at all, according to the Dietary Guidelines for Americans.
Oklahoma's Department of Health says kids aren't only drinking those sugary beverages, they're also going without fruits and veggies.
Oklahoma actually ranks 13th in the nation in terms of highest childhood obesity rates. And that means that about 1/3 of our children in Oklahoma are considered obese or overweight.
They say kids in Oklahoma aren't necessarily making the choice to say no to vegetables.
This is largely due to environmental factors, including lack of access to nutritious and affordable foods.
According to the report, more than 72% of kids in Oklahoma, ages 1 to 5, have had at least one sugary drink in the last week. That's more than 15% higher than the national average.
So it may be the norm to sit down and have a glass of sweet tea with a meal, or sit down and have a pop or a soda with a meal. And so what we really need to work on is kind of changing that mindset.
Lauren Larson is also a parent and shares how she gets her kids to eat nutritious and drink less sugar.
I know that they love to grab a can out of the fridge. And so what I try to do is I try to buy some of that fun sparkling water. Let's say you're buying some fresh carrots. Go ahead and chop them up. We know that a bag of chips is really easy to grab and just start munching on. But if the vegetables are just as easy to start munching on, your kids are much more likely to try them. The State Department of Health says part of their state obesity plan is making sure people, including kids, can get that nutritious food for less money.